Okay, so now let's discuss about Ebola virus. So Ebola is another virus that can cause fatal and severe illness in human and primates. Okay, so Ebola virus, a condition that was previously known as Ebola hemorrhagic fever, causes death of 25 to 90% of the people affected. Okay, so Ebola virus is the virus of the family Filboviridae and genus Ebola virus. Okay, so Ebola virus genus can be divided into four parts. One is Zaire Sudan, Tidy Forest, Bundi Buigo, and that is Bundi Bugio, not Bundi Buigo. So Bundi Bugio and Reston. So Zaire Sudan is the most dangerous one and causes most of the outbreaks, largest outbreaks, and Reston do not causes any kind of fatality in human, but it causes symptoms in primates. Okay, so up to that part we have learned that Ebola is a kind of virus that causes fatal illness and severe illness in human and primates, right? So now Ebola virus, also a condition that is previously known as Ebola hemorrhagic fever, is very fatal, causes death of 25 to 90% of the affected people. So Ebola virus is coming from the family Filboviridae of genus Ebola virus, and Ebola virus genus can be divided into four species. One is Zaire Sudan, which is the most common and most dangerous one and causes largest outbreaks, along with Tidy Forest, Bundi Bugio, and Reston. So now mode of the transmission. So I want to discuss with you that Ebola virus is a zoonotic virus. Zoonotic virus means it originates from the animals, okay, and then via body fluid it will transferred to the human. So the question is, what kind of animal? So the first animal that I want to tell you is the fruit bat. Okay, that is the natural host of Ebola virus. Along with the bodily fluid from chimpanzees, monkeys can also transmit Ebola virus into human, and that's how Ebola virus enters into the human population. Okay, and now Ebola can be transferred from human to human via saliva. And here I want to add a point that according to who the person who have developed a severe sickness or a good amount of sickness or serious sickness can transmit the Ebola virus via his or her saliva. Okay, and human can also transfer Ebola virus to another human via semen through sexual contact. Human's breast milk can also contain Ebola virus, so it can be transferred to the children via mother also. Along with that, tears, stool, urine, sweat, mucus. That means you can say that any kind of bodily secretion of a Ebola infected person could be dangerous, right? It can transmit the Ebola to another healthy person. So portals of entry are mouth, abrasion, open wounds, cut, nose, eye. Okay, now let's talk about some risk factors. So dead body also remain infectious, so the person who are preparing the burial for Ebola virus infected patients are at risk, along with the healthcare providers and the close family members of the Ebola patient are also at risk. Okay, and another important thing that you need to know that is Ebola virus remains in the breast milk and semen even after recovery. Okay, so that is why World Health Organization who recommends to avoid breastfeeding and physical intercourse for some time after recovery, right? So that it cannot be further transmitted. Okay, so up to that point we have learned that Ebola virus is a virus that causes severe and fatal illness in human and other primates. Okay, so here the Ebola virus infection is previously known as Ebola hemorrhagic fever that cause death of 25 to 90% of the affected people. Okay, and Ebola virus is coming from the family Filboviridae and genus Ebola virus, and Ebola virus can divide its genus into 4 species. Okay, one is our Zaire Sudan, another one is Tidy Forest, another one is Bundibugyo, another one is Reston. Okay, so among them the Zaire Sudan is the most dangerous one and causes the largest outbreaks, and Reston is the species that do not cause any fatality to human but can cause disease to other primates. So mode of transmission is from animals, because it is a zoonotic virus, is first transferred to the human via bodily secretion. The most common animals that can transmit the chikungunya virus are our chimpanzees, monkeys, and fruit bat. And fruit bat is the natural host of Ebola virus. That is important for MCQ purpose. And from human it can be transmitted via various things such as saliva, such as your semen, breast milk, such as tears, such as sweats, stools, urine, etc. Okay, that means any kind of bodily fluid can transmit Ebola virus. So portals of entry are easy to guess: mouth, noses, eye, open wound, cut, and abrasion. So dead body as remain infectious, so the person who prepares burial are at risk, healthcare workers are at risk, and Ebola virus remain inside the breast milk and semen even after recovery. That is why who recommends to avoid sexual intercourse and breastfeeding for some time after the recovery. So symptoms, incubation period is 2 to 21 days. Okay, you may observe high fever, sore throat, joint pain, muscle and joint pain, along with you can observe lack of appetite, along with you can observe in some patients mostly, that is red eyes, then rashes, then difficulty swallowing, difficulties breathing, and bleeding, cough and hiccups. Okay, so that are the important symptoms. Now how can you diagnose it? So first job of the doctor is to rule out other possible conditions that share common symptoms. Okay, then another thing that he or she must have to keep in their mind, that the specimen and sample they are handling with, if it contain Ebola virus, then it will be extremely biohazardous. Okay, so the experimentation will be going on under a good biological containment condition. Okay, so Eliza test can be done, which will be antigen capture test. That is our important Eliza test, which is known as competitive Eliza. I have made a video regarding competitive Eliza. If you want to know about competitive Eliza, then you can go into my YouTube channel and find out video regarding this. Along with IgM Eliza. IgM Eliza means here we are finding out IgM antibody specific for the Ebola virus antigen. Along with PCR virus isolation by cell culture of electron microscopy, with the virus isolation by cell culture, and then we will look the virus with the help of electron microscopy. Treatment, no treatment required. Our immune system will fight against it by its own, and if required some medication, then our first goal will be to reduces the symptoms. Okay, and that can be done with the help of some fluid that can be inserted orally or intravenously. Then oxygen, blood pressure medication, blood transfusion can be done. So prevention, wash your hand with soaps very frequently. Okay, and wash and peel the fruits and vegetables well before eating. That is the two. And avoid eating bushmeats and any kind of raw meat of dead animals. Okay, and avoid doing any kind of physical intercourse with a person that shows some symptoms. Okay, that are the important preventions that you need to keep in your mind from Ebola virus. So in Ebola virus we have learned that Ebola virus is a serious and fatal illness caused by Ebola virus, and it is usually caused in human and primates. So Ebola virus infection is previously known as Ebola hemorrhagic fever that have a very significantly high death rate. 25 to 90% of the affected people is died because of that condition. So it is from the family Filboviridae and genus Ebola virus. So Ebola virus have 4 species. One is our Zaidi Sudan, another one is Tidy Forest, another one is our Reston, and another one is Bundibugyo. Among them, Reston do not cause any fatality to human, and Zaidi Sudan is the most dangerous one. So mode of transmission, it will originate in the animals, and from the animals via secretion it will transfer to the human. Here the important animals are chimpanzee, monkey, and important thing that is fruit bat. Okay, and from human via various bodily secretion it can transfer to other human. So portal of entry is easy to guess: mouth, nose, ears, eyes, open wounds, and cuts and abrasions. Okay, so dead body as remain infectious, so the person who prepares the burial for Ebola infected patients are at risk, along with the healthcare workers and family members are at risk. And Ebola virus remains in the semen and the breast milk, so who recommends to avoid physical contact and breastfeeding just after recovery. Okay, so symptoms are 2 to 21 days, high fever, sore throat, along with the pain in the muscle, along with the joint and muscle pain, along with you may observe fatigue, lack of appetite, along with rash, red eye, difficulty swallowing, difficulty breathing, bleeding, along with cough and hiccups. So other condition, so diagnosis will be, first goal will be to rule out other condition that shares the common symptoms. Then we will do ELISA, that can be captured ELISA, that can be our competitive ELISA. Here we are using captured antigen, and then we can use also IgM ELISA. We can use also PCR technique to find out the pathogen, along with virus isolation by cell culture electron microscopy. Treatment are no such kind of treatment required, but fluid which is applied intravenously or orally to reduces the symptom, along with blood transfusion, blood pressure medication can be done. So prevention are wash the hand very carefully with soap and frequently, and then wash and properly peel vegetables and fruit before eating, and then avoid eating bush meat and any kind of raw meat of the dead animal, and avoid sexual intercourse with any partner that shows symptoms common to Ebola virus. Okay, so that is the concept regarding Ebola virus. So thank you for listening to this class.